Welcome back. You know, summer is quickly approaching, and if you're hoping to show a little more skin but feel a little uncomfortable with some of that extra weight, you're not alone. And you definitely should not be alone in your quest to drop those pounds either. Dr. Michael Parsons has been through it all herself and wants to help you get to your dream weight as well, just in time for those hot summer months.
Absolutely.
Yeah, and I know that we talk about it on a weekly basis almost, but we really want to get the message out there, right, Dr. P, that people can do this, that it is something that's doable for them.
Yes.
So if they're sitting there and they feel bad about themselves, it's as simple as making the phone call.
Yes, a lot of people, and I know because I was one of those people, feel trapped, especially when you know you're doing the right things and your body isn't responding the way it should. So I want people to understand that there's a reason why their body's not burning fat, and I know how to figure it out. That's one of the things that I've had to do for myself and all of my other patients.
So then you have patients who constantly work out and eat right.
Yes.
Is it mainly because of age, or as you mentioned,
Has
because
nothing to do with age.
Really? Because I always heard, well, once you hit 30, once you hit 40, forget it.
No, those are excuses. Those are excuses that we put on ourselves to feel better. Well, it's your body does change as you age, but that's not why you don't burn fat. If that were the case, everyone in their 30s would be fat, and they're not. Yeah. So we can't, I don't use the age card. It's not allowed.
Good.
There's a reason why that your body's out of balance.
Summer's coming up. Yes. And so this, for some people, is kind of
it's stressful.
Very stressful time.
When you are not feeling good in your body and it's hot, I so remember, like, just breathing air made me sweat. And there was no way I was going to wear, you know, shorts or a short sleeve top because my fat jiggled. And I didn't want people to see that. And then when you're really overweight, that friction of the walking between your thighs can be very painful. A lot of people who've never been overweight don't understand the emotional component, and it's something that a lot of women in particular they'll never talk about that. It's so deep and so private and so tender. Yeah. But they don't have to be trapped by that body. Go to someone who knows how to figure it out.
And how realistic should we be as far as how long it'll take on this program to drop the weight?
We're seeing amazing transformations. My program is 14 weeks, and it's set up that way because there's specific things we're doing amongst the 3 phases of the program. And there are things that we need to accomplish, and we need to make sure that the body stabilizes, holds, and maintains that weight. And then we're able to figure out what, from a biochemical standpoint, what foods are going to keep that weight loss, what foods are going to bump it up again, and then what to do if that happens. So this really is a program that helps to reveal from A to Z why you might have been out of balance, get your body into fat burning, which it's forgotten how to do, teach you and others around you what is a balanced meal, how do I maintain a healthy lifestyle, how do I live like a healthy person, and then how to maintain it, but still have those indulgences that might bump the weight up, but know what to do to get it off so you don't ever have to start the fat accumulation again.
Okay, and how much weight did you lose? Because I know that you feel better. You've gone through the program.
Yes.
And what was life back then compared to now? Because you are so active. I've never met anyone so busy and so active.
I was starting to not play life out to the fullest. I would look at myself and just want to cry. I felt just like, even though some people would look at that before picture and say, well, that's not bad. For me, that was big deal. And I wasn't able to fit in my clothes anymore. I was having thoughts of, really, I think I was going towards an emotional breakdown because that wasn't who I was. I didn't feel good in my skin. I didn't know who that person was. And when you can't zip up your pants that you wore last week, that's really emotionally traumatic. It's very traumatic. And then have to bump up the next size, and I just felt like everyone was staring at me, even though I know they weren't. But there's a lot of crazy self-talk that goes in that not being at a healthy weight triggers.
Well, it's nice that you experience it also. You pass along this information to your patients and help them deal with even the emotional stresses that come with trying to lose weight. So call 447-1404 and find out more about the program.
Absolutely.
Because you're changing a lifestyle. You're not just helping them lose pounds.
This isn't a quick fix. This is I want to live healthy for the rest of my life, which will free you up to bring your A game every day to your day.
And it starts by Dr. P figuring out why maybe you're not losing weight, which
That's
is,
right.
once you figure that out, it's probably like just such a relief.
It is.
All right, 447-1404. You can also visit naturalpathfresno.com or go by and visit Dr. P at 745 East Locust Avenue and get your toxicity test. That's part of it.
Yep.
That's part of it, and it's super easy, and I'm sure we'll talk more about it next week.
Absolutely.
All right, Dr. P, we'll talk to you soon. All right, we'll be right back, everybody. Stick around.